Why the Canary Islands Hantavirus cruise ship is triggering fresh pandemic fears across Europe. The luxury cruise that became a floating health emergency. A luxury expedition cruise that began as an elite Atlantic adventure is now heading toward the Canary Islands, under the shadow of a rare and deadly virus outbreak that has already claimed multiple lives. The MV Hondius, a Dutch-flagged polar expedition ship carrying around 150 passengers and crew, is expected to dock in Tenerife after an escalating hantavirus crisis transformed the vessel into one of the most closely watched ships in the world. What started as isolated illnesses aboard a remote South Atlantic voyage has rapidly evolved into a multi-country health operation involving the World Health Organization, European authorities, and emergency medical teams. The fear surrounding the ship is not simply about the number of cases. It is about what the outbreak represents. For many residents of the Canary Islands, the arrival of the MV Hondius has reopened memories of the early COVID era, when Tenerife became one of the first places in Europe to experience large-scale quarantines. The emotional reaction has been immediate: anxiety, anger, political pressure, and growing concern about whether authorities are underestimating the symbolic and psychological impact of allowing the ship to dock. The detail that makes this outbreak different: hantavirus is not COVID. That distinction matters. Most hantavirus strains spread through contact with infected rodent urine, saliva, or droppings. Human-to-human transmission is usually considered extremely rare, but investigators believe the outbreak aboard the MV Hondius may involve the Andes strain, the one hantavirus variant known to spread between people under close, prolonged contact conditions. That single detail changes the emotional temperature of the story. Health officials continue to stress that the wider public risk remains low. The World Health Organization has repeatedly emphasized that sustained community transmission is unlikely. Yet the fact that multiple passengers across several countries are now under monitoring has created the kind of international uncertainty that immediately captures public attention. The numbers alone explain why the story has escalated so quickly. As of Friday, authorities were tracking multiple confirmed and suspected cases linked to the ship across several countries, alongside 3 deaths connected to the outbreak investigation. Patients have reportedly been monitored or treated in South Africa, the Netherlands, Germany, Switzerland, St. Helena, and elsewhere as contact tracing widened internationally. Why Tenerife suddenly feels like the front line. The Canary Islands did not ask for this role. Spanish authorities agreed to allow the ship to dock following coordination with international health agencies, despite strong objections from regional leaders worried about the consequences for the islands. The political tension underneath the decision has become impossible to ignore. Tenerife is one of Europe's most tourism-dependent destinations. The idea of becoming internationally associated with another infectious disease emergency carries enormous psychological and economic weight. That is why the reaction on the islands has been so emotionally charged. Local residents interviewed in recently described fears of hospital lockdowns, quarantine scenarios, and renewed disruption to daily life. Even though officials insist the public risk is limited, the imagery surrounding the ship has proven impossible to separate from collective pandemic memory. There is also a deeper tension driving the anxiety. People remember how quickly low-risk situations evolved during the earliest days of COVID. That memory now sits behind almost every public conversation surrounding the Hondius crisis, even if the scientific realities are completely unique. The cruise route that turned into an international investigation, the voyage itself, now reads like the opening chapter of a disaster thriller. The MV Hondius departed Ushuaia, Argentina in early April for an Atlantic Odyssey route that included Antarctica and remote South Atlantic islands. According to outbreak timelines now under investigation, the first passenger death occurred weeks before hantavirus was publicly identified as a possible cause. As additional illnesses emerged, the ship was eventually diverted toward Cape Verde, where authorities refused normal disembarkation procedures amid mounting concern over the outbreak. Several critically ill passengers were later evacuated for treatment, while the vessel remained stranded offshore. The longer the situation continued, the more complicated the international tracing effort became. Passengers from multiple countries had already disembarked at various locations during the voyage before the outbreak response intensified. Health agencies are now attempting to track exposures across continents, while determining exactly where and how the virus spread on board. That uncertainty is one reason the story continues to dominate headlines. The question scientists are quietly trying to answer. The scientific mystery underneath the crisis may prove more important than the ship itself. Investigators are still trying to determine whether the outbreak began through environmental contamination on board, exposure during shore visits, or rare person-to-person transmission. That distinction matters enormously because it shapes how we would assess and control future outbreaks. Hantaviruses have long been treated as dangerous, but relatively contained pathogens. Most outbreaks remain localized and linked to rodent exposure. A cruise ship cluster involving possible interpersonal spread immediately forces scientists and health authorities to reassess assumptions about containment dynamics in enclosed environments. That does not mean a pandemic scenario is likely. Experts continue to say the virus spreads far less efficiently than airborne respiratory viruses like COVID-19. But seeing a rare virus travel internationally aboard a luxury cruise ship has a powerful psychological effect because it directly collides with modern fears about global mobility, tourism, and invisible biological risk. The image alone is enough to trigger alarm. What most people are missing about the cruise ship panic. The most revealing part of this story may not be the virus itself. It is the speed at which societies now react to the possibility of uncontrolled disease spread. Within days, a remote outbreak aboard a specialist expedition vessel evolved into a global news story involving emergency evacuations, international coordination, public anxiety, and fears of renewed quarantine to style disruption. The emotional infrastructure created by COVID still shapes how populations interpret health threats, especially when ships, borders, isolation, and uncertain transmission are involved. That explains why the Hondius crisis feels bigger than the raw case numbers alone. The story taps directly into a modern psychological pressure point, the fear that the next international outbreak could emerge suddenly, travel silently, and reach Europe before authorities fully understand what they are dealing with. For now, health officials insist the situation remains manageable. Tenerife is preparing controlled medical procedures and passenger handling protocols, rather than mass emergency measures. But the crisis has already exposed something deeper. The world may have moved on from the visible restrictions of the pandemic years, yet the emotional memory of uncontrolled global contagion still sits just beneath the surface, waiting for the next ship, the next outbreak, or the next unexplained cluster to bring it flooding back. And now, that ship is heading for the Canary Islands.